Ever heard of bursitis? No? Well, it's about time we discuss this relatively common but often overlooked condition. Bursitis is an inflammation of the bursae. Not sure what those are? Let me explain. Our bodies have these tiny fluid-filled sacs called bursae. Their job? To act as buffers, cushioning the bones, tendons and muscles near our joints. Think of them as tiny pillows, keeping everything comfortable as we move around. Now imagine if these little pillows got inflamed. That's bursitis for you. It can happen in various parts of the body, from your elbow to your hip, your shoulder to your knee, and it's often brought on by repetitive movements or pressure, like lifting heavy objects over and over or kneeling for long periods. So that's bursitis in a nutshell. But what causes it? Let's dive in. So what's the culprit behind bursitis? It's typically a case of too much of a good thing. Let's delve into the causes of bursitis. This condition is often a consequence of repetitive motions or persistent pressure on a joint. Imagine a baseball player constantly swinging his bat, or a gardener frequently down on her knees planting flowers. Over time, these repetitive actions can irritate the bursae, leading to inflammation and bursitis. But it's not just repetition that can be a problem. Even seemingly harmless habits, like leaning your elbows on a desk for extended periods, can put undue stress on the bursa, triggering bursitis. Bursitis may also result from a sudden injury, like a fall or a direct blow to a joint. And let's not forget underlying inflammatory conditions, such as rheumatoid arthritis, which can also provoke this ailment. Now that we know what leads to bursitis, what signs should you look out for? Bursitis is not a silent condition. It often sends out distress signals in the form of symptoms. The first and most common symptom of bursitis is pain. This pain is usually located in the area of the inflamed bursa, which can be any joint in the body. The pain may build up gradually, starting off mild and becoming more intense as time goes on. In other instances, the pain can be severe and sudden. Another symptom you might experience is swelling in the affected area. This can be accompanied by redness and a sensation of warmth. Stiffness is also a common symptom, especially in the morning or after periods of inactivity. This stiffness might make it hard to move the affected joint, and you may find that the pain worsens with movement or pressure. So if you notice these symptoms, how do health professionals diagnose bursitis? Diagnosing bursitis is a crucial step towards recovery. But how do doctors figure it out? Well, a medical professional typically begins with a physical examination. They'll check for tenderness, swelling, and pain in the affected area, and they'll ask about your symptoms and any activities that might have led to them. In some cases, the doctor might need to get a clearer picture of what's going on inside your body. That's where imaging tests come in. An X-ray can help rule out other issues, like fractures. An ultrasound or MRI can provide a detailed image of the bursa, revealing inflammation or other abnormalities. Sometimes, the doctor may also aspirate or draw out fluid from the bursa for further testing. This can help determine if an infection or gout is the cause of your symptoms. So once all these steps are taken and the reports are in, the doctor can confirm a diagnosis of bursitis. With a confirmed diagnosis, what's the next step? Treatment, of course. Treatment for bursitis aims to alleviate pain and inflammation. But how is this achieved? Let's dive in. The primary approach involves rest and ice. Resting the affected area reduces stress on the bursa, while ice application helps minimize inflammation and swelling. Over-the-counter anti-inflammatory drugs such as ibuprofen can also provide relief by reducing inflammation. In some cases, physical therapy might be recommended to strengthen the muscles around the affected joint and improve its function. Now, if these measures don't provide sufficient relief, healthcare professionals may resort to more aggressive treatments like corticosteroid injections. These injections can rapidly reduce inflammation and pain. In the most severe cases, surgery might be necessary to remove the inflamed bursa. However, it's important to note that every individual is different, and treatment plans should be personalized based on the patient's condition and needs. So there you have it, a comprehensive look at bursitis. Remember, health is wealth, so always listen to your body and seek professional help when needed.